You've been self-quarantining, but you're also a doctor. What happened?
The way it started was I was, on a regular work routine. So till Sunday, I had a little sore throat. Then last week, I found out the 3 patients I saw, they turned out to be positive. I have been following for a couple of weeks with the precautions as recommended by CDC. I went to my occupational health services. They made me quarantine and did the test on Tuesday, and I am waiting for the results. Interestingly, that initial few days, couple of days, I felt it was a little mild cough, but since yesterday, my symptoms are a little worse than before, but
I was going to ask that. First and foremost, how are you feeling?
I would say this is a regular illness, viral illness, which we all go through here and there, and we just carry on with our life. But since this is a different kind of situation, we have to be a little more careful and more vigilant about how we're going to handle things. The testing itself has been it's not been easy, even for colleagues who are with me who have symptoms, even though the symptoms may not be related, because these symptoms are very common with other kind of illnesses too. It's not that you always will have coronavirus or COVID-19. You may not. So if we do testing for this, we can clear out some people. Maybe I had that and I'm just asymptomatic and just spreading to my patients. So if we have those protective gear, we prevent that. And second of all, we will know that we are asymptomatic, we are fine, we can monitor ourselves.
When are you expecting to get the results?
So initially they said it will be 24 hours, but then they were so backed up with so many probably testing things that it's 3 to 5 days. Now I think they changed to a different lab. Now turnaround time is decreasing. But I hope if there is a way to decrease the turnaround time more, which probably is there, it's just that we are catching up on that, then it will help the people make decisions and decrease this anxiety.
Is there a moment or an experience that you can compare this to?
This is totally different territory, at least in my experience. People who are older than me, they may have experienced more than me. I've been in medicine since I graduated in med school in 1998, so my experience is 22 years, but not this way. This is uncharted territory for all of us, and I think this will teach us a lot of things. We will learn a lot of things out of it. I hope it happens faster, slows down faster, and we are able to take care of people faster.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.